Medicare is going through some major changes in 2026, and if you're on Medicare now or you're eligible soon, it's important to know how these updates could affect your coverage, your costs, and even how you get your care. So today, I'm walking you through the most important changes coming to Medicare in 2026 so that you have ample time to prepare before the annual enrollment period starts on October 15th this year. So let's start with your Medicare costs because that's one of the biggest factors for most people. For 2026, the standard monthly premium for Medicare Part B is projected to increase by 11.6%, going up from $185 a month to $206.50 in 2026. That's an increase of nearly $22 each month, or almost $264 a year. The annual Part B deductible is also going up from $257 to $288, so that means you'll need to spend more out of pocket before your coverage kicks in. For a lot of people, these increases will take up a significant portion of the cost of living adjustment in Social Security. Estimates suggest the premium hike alone could eat up nearly 40% of that COLA increase. So I cannot stress this enough, but if you're on a fixed income, these are numbers you'll definitely want to work into your 2026 budget. Next up is Medicare Part D drug coverage changes. The annual out-of-pocket spending cap for prescription drugs under Part D is rising slightly from $2,000 to $2,100. While it's still a strong protection compared to past years when there was no cap at all, it's a reminder that even capped costs can still go up over time. One positive change is the $35 monthly cap on insulin will become a permanent fixture in 2026 for all Medicare beneficiaries, and you won't even have to meet a deductible first. And back in August of 2022, Biden signed the Inflation Reduction Act into law. This law gave Medicare something it never had before, and that's the power to directly negotiate the prices of certain high-cost prescription drugs. The first round includes 10 Part D drugs. These are medications widely used by Medicare beneficiaries, and they usually have high out-of-pocket costs. Negotiated prices will take effect in early 2026, with more drugs hopefully to be added in the following years. Some of the drugs include Eliquis, Jardiance, Farxiga, and Stelara. So if you take one of these medications, you could see lower costs starting in 2026, although your exact savings will depend on your plan choice. And hopefully, over the years, more drugs will be added to that negotiation list. We covered this topic in detail last year, including what all this negotiation process means and how it's expected to roll out. So if you'd like to dig a little bit deeper into the background of this negotiation process and what to expect, you can read the full article over on our website, navaquote.com. I'll put the link in the description below for you. Now, if you're on a Medicare Advantage plan, pay close attention this fall because insurance companies are adjusting their plans in response to rising healthcare costs and new regulations. This could mean higher premiums, reduced benefits, changes to provider networks, or in some cases, plans leaving certain areas altogether. Your annual notice of change or ANOC letter, which you should receive by September, will outline exactly what's changing in your plan. And reviewing that document very carefully this year is essential to avoid surprises in January of 2026. And lastly, traditional Medicare will begin requiring prior authorization rules in 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington for certain services. I cover what all that means, which services are affected, and how to best prepare in our other video, which I'll link somewhere around here for you, about prior authorizations coming to traditional Medicare in 2026. The goal is to reduce unnecessary procedures and control costs, but it also means that you may need approval before getting certain types of care. So if you live in any one of those 6 states, understanding these requirements ahead of time can really help prevent delays in treatment going into 2026. So here's the bigger picture for 2026. Premiums and deductibles are rising, so make sure that these fit into your budget for next year. Part D drug coverage has a higher cap, but insulin costs will be permanently limited. Medicare drug price negotiations are starting, which may gradually lower certain costs. And Medicare Advantage benefits may change, so review your annual notice of change letter very closely when it arrives sometime in September. And prior authorization is unfortunately coming to original Medicare for the first time in 6 states, so know the rules if you're affected. And the annual enrollment period is October 15th through December 7th, but the most important thing you can do right now is start planning. Review your current coverage, Think about your healthcare needs for next year and compare your options before the rush begins. I'm Callie Navrides, a licensed insurance broker and certified Medicare expert and founder of NaviQuote. If you'd like help reviewing your plan or exploring your options for 2026, you can reach out to me directly or schedule an appointment using the link in the description below. And if you have any questions about these changes, please leave them in the comments so I can cover them in a future video. And if you found this video helpful, please consider liking and subscribing to the channel for more expert tips. And after that, click right over here to check out my next video on the top 5 biggest Medicare mistakes to avoid during annual enrollment. Thanks so much for watching, and I'll see y'all in the next video.